Hi, you're listening to the Baby Manual podcast, the podcast that helps you feel confident as a new parent. I'm your host, a pediatrician and mom, and the author of the Baby Manual, Dr. Carole Keim. Hello, and welcome to the Baby Manual podcast. This week, we're going to talk about stuff that you need to know before your baby is born. So if you're still pregnant, this episode is for you. First of all, we're going to talk about how to tell you're in labor. Then I'll let you know what happens at the hospital and what I recommend you do while you're in the hospital. And then I'm going to go through my discharge instructions, which means before you go home, all the things that you need to know. All right, here we go. In order to tell if you're in labor or not, so one sign is if your water breaks. Now, when your water breaks, it's typically going to be a big gush of fluid. It might soak all the way down to your socks, but it might not. The thing is, after your water breaks, it's going to keep leaking because your body keeps making amniotic fluid. So I recommend putting a pad in your underwear to catch that extra fluid because it's just going to keep going until you get to the hospital. Another way to tell is if you're having contractions. Now, it takes regular contractions, meaning a contraction every 2 to 5 minutes for at least half an hour to an hour to make your cervix change. Now, the more babies you've had, the faster it tends to go, and some women will go into labor faster than others. So once you're having contractions on a regular basis, you feel like they're coming every couple of minutes, it's time to head into the hospital. And if you're not sure if your contractions are regular enough or strong enough, you can always call your OB and ask. Now, in terms of how long you're going to be in labor, a lot of women with the first baby will be in labor for a while. And what I mean by that is somewhere between 12 and 72 hours. So it can be quite a while before your baby comes out. It's usually not super fast. But again, there's exceptions to every rule. And sometimes it is really fast, like as soon as you get to the hospital. I do recommend having babies in the hospital as opposed to a home birth, just because home birth babies, there's a much higher risk of complications, including brain damage and even death for your baby, way higher than if you're in the hospital. So I do highly recommend that. And of course, as a pediatrician, I'm a little bit biased because they only call the pediatrician into the delivery if there's something that's expected not to be going perfectly 100% right. So they'll put monitors on your belly when you get to the hospital, and they look like these little round circular plastic discs, and they strap them on with an elastic belt. And what those read are your contractions, and they read the baby's heartbeat at the same time. And that creates what's called a CST, or contraction stress test, and that tells us how baby is tolerating the labor. So we watch baby's heart rate as you get contractions, and we see if the heart rate stays nice and high. If it varies a lot, it should be between 120 and 160 beats per minute, and it should go up and down. Then we see if it changes in relation to the contractions. So if your baby's heart rate goes down with contractions, that can mean a couple of different things, and that's typically when they would call me in to come be there for the delivery, is if they're having decelerations or their heart rate's going down lower. Now, there are a couple different ways to get a baby out of a body, but the two that we do here are a vaginal delivery or a C-section. Now, I would definitely recommend a vaginal delivery if you're able to have one, but we'll go through why in just a moment. So with a C-section, there's a whole lot of layers that they need to cut through. It's not a simple, one slice procedure. You have to cut through your skin, your fat underneath that, then your muscles, your abdominal muscles. Then they have to move your bladder out of the way so that doesn't get nicked, and then slice through the uterus, which is another muscle. And sometimes there's something called the omentum in front of that, which is another organ that overlies your abdomen. Sometimes that has to be sliced or moved. And then they cut through the uterus, and then there's the amniotic sac, and then you've got baby on the inside of that. And so a C-section requires all of these layers to be cut through, and all of them except for the amniotic sac need to be stitched up on the way back out. So if you think about how much a paper cut hurts, and that's just your skin, it's like way, way deeper than that. It takes quite a while to heal from a C-section. It is a pretty major surgery. And it's hard to walk around afterwards. It's hard to carry a baby around. And the anesthesia they use can make you really constipated, and it can be hard to poop after a C-section too. So if you don't need one, I'd say don't get one. But of course, the OB is going to do whatever is best for you and your baby. And sometimes you need to be rushed into C-section if baby's not doing well on those monitors when we're checking you in the hospital. Now, vaginal delivery, The reason I say that that's the way to go if you can is because there's a hole already there. You've got your uterus, which connects to your cervix, and the cervix is the neck of the uterus where it meets the vagina. And the cervix dilates up. It gets to be 10 centimeters wide, which is about as big as a baby head. Then there's just a nice, easy passageway for the baby to slip out through there. Even large babies tend to fit through the cervix and the pelvis and the vagina on their way out. Sometimes you do end up with tears, but those are, again, just usually the top layer of skin and sometimes the subcutaneous tissue, the fatty tissue there, and almost never involve muscles. So even if you need stitches after a vaginal delivery, it's going to be a lot less traumatic to your body than a C-section would be. Once you've had one C-section, a lot of times they'll recommend only having C-sections in the future. And that's because after your uterus has been cut and stitched back together, it is at higher risk of actually rupturing or breaking during the delivery. And that is a very high risk for mom and for baby both. Could be life-threatening, and there's even a chance that you could lose your uterus. So talk to your OB to see whether a VBAC or vaginal birth after C-section would be okay for you or if it would be too risky. Now, who's going to be in the room for your delivery? Nowadays, with the pandemic going on, it's a little bit different, but typically, when it's not pandemic times, you're allowed to choose who's in the room with you in terms of your support people. So that could be your parents, could be your spouse, could be a doula, perhaps a friend, things like that, a sibling. It's up to you to decide. During the pandemic now, it seems like they're only allowing one person in most hospitals, and some will allow two people in. So talk to your hospital and see what they'll allow. But on top of that, you're going to have a nurse that's there just for mom, a nurse that's there just for the baby, and your OBGYN or midwife, who's the person who is actually catching the baby or, delivering that baby on the way out. Sometimes the pediatrician will be there. So like I said before, I only get called when there's something that's not going 100% right. Maybe there's meconium, which means that the baby pooped on the inside. And meconium is usually a sign that baby's a little bit stressed out or that they're past their due date. Or sometimes it means that they're not looking great on the monitor, that their heart rate is not doing what it should be. Also, if mom gets a fever during the delivery, that's another reason that they would call me in to check the baby when they're first born. Once baby is out, the pediatrician or sometimes the family doctor or sometimes just the nurse, whoever's there for the baby specifically, will assign what's called an APGAR score. The APGAR score, it really just tells us how well a baby's making a transition from the inside to the outside. A typical APGAR score will go as high as 10, but should normally be it's 8 or 9 for the first one at 1 minute and usually 9 for the second one. If the APGAR score stays below 7 by the 5-minute check, then we do a third APGAR score at 10 minutes of life. Now, the reason we have a pediatrician there or someone that's there just for the baby is in case they need a little bit of help breathing. We'll dry them off, make sure they'll be nice and stimulated and trying to breathe on their own. But if they're not breathing on their own, that's why we're there. We can give them oxygen if they need it. It happens more often than you think. So again, I do highly recommend being in the hospital when you deliver your baby in case they do need that. Then after they're born, we do a vitamin K injection, which is a shot. It's not a vaccine, it's a vitamin. And the reason we give babies that vitamin K shot when they're first born is to prevent bleeding. Now, a lot of babies used to die from vitamin K deficient bleeding. The vitamin K shot prevents all of those cases. So it's really great. It's highly recommended. They do that in all developed countries routinely. Then there's also something called erythromycin eye ointment that we put on babies' eyes, and that helps prevent them from getting pink eye when they're first born. It's primarily meant to treat gonorrhea and chlamydia, but also there's normal flora that lives in the vagina, and all of those things can cause a pretty bad pink eye in your baby. So the erythromycin ointment will prevent all of that. Sometimes we will give them their hepatitis B vaccine in the hospital. The reason we do that is to prevent transmission of hepatitis B from mom to baby. And most moms will be tested for Hep B in their pregnancy, but there's always a chance that you could contract it after that test and or that you don't know that you haven't and you might read like a false negative test. So we usually give the Hep B around 1 or 2 days of life. or you can also get it when your baby is first in the office. Then we also do a newborn screen before they leave the hospital. And that's just a little heel stick, and we take 5 drops of blood, put it on a special kind of a card, mail that card into the state, and the state analyzes it for some rare genetic conditions. The reason we do this on every baby, even though they almost never come up positive, is that if it is positive, a lot of these conditions can cause brain damage if they're not treated right away. So it helps us know if there's something we need to check and see a little bit further. And it is just a screen. So if you do get a positive, there's a decent chance that it's a false positive. So if that happens, any positives on the newborn screen need to be confirmed with a confirmatory test that will tell you whether your baby actually has that condition or not. So what I recommend while you're in the hospital, try to breastfeed if you can. We always talk about how breast is best. Now they're saying fed is best. So of course, yes, any formula is okay as well. But the reason I love breastfeeding so much is that it has so many benefits for you and for the baby. One of the biggest benefits is that it's going to help give your baby protection against diseases. Your breast milk has antibodies in it, and antibodies are the things that fight off bacteria and viruses. And when you're around your baby, when you're kissing them, you're picking up all the germs in the environment and you're making antibodies to just what they need. It's pretty amazing. Also, breast milk changes as your baby gets older, and it's always exactly enough for what they need. Each time your baby feeds, it's like they're placing an order for the next time. So when you first start off breastfeeding, you want to do it for 15 minutes on each side so that your breasts get that stimulation to produce milk. For the first 3 to 5 days of life, you're just producing something called colostrum, which is a yellow color. It's very concentrated and it's a very small amount, only tiny drops. A lot of times you can't even tell if anything is coming out. But it is, keep that baby on there for that 15 minutes on each side, and you will start producing that. Then after around 3 to 5 days, you should get a surge in your milk. And then your milk starts coming in white and in greater volume. And you'll probably feel your breasts get really big around day 3 to 5, really full. And then you'll feel them empty each time the baby eats. If you're going to be pumping and giving bottles, I recommend doing that even right from the beginning. There's no time that's too early to start with the pumping. So as soon as baby's out of your body, you can start using your breast pump. And that will also give your breasts the stimulation that they need to produce milk. So I'd say feed the baby first. And then after baby's done, if you're going to pump, then pump afterwards. Now with the breast pump, you don't have to turn it up very high. You just want it high enough that it feels like the baby. If you go too high on it, it'll actually make your ducts spasm and close down and you won't get any more milk out. So just high enough that you're starting to feel it and that you feel milk coming out as it gets a little bit later. You can talk to your nurses about your baby's latch, and they can watch your baby breastfeed and give you tips on how to get them latched on really well. You can also hear your baby sucking and swallowing when they're eating. So that's one way to know that milk is actually coming out, is that you can hear the baby swallow. While you're in the hospital, you're going to write down every time your baby starts eating and finishes eating, and also every time they pee and poop. Because everybody who walks into your room is going to ask you, when's the last time they ate? When's the last time they peed and pooped? And it's really hard to remember that because they're going to be eating approximately once every 2 to 3 hours. Now, babies do tend to cluster feed in the wee morning hours. So your prolactin level is the highest between midnight and 6 a.m., which of course is the least convenient time of day to be breastfeeding. That's why I say it's evidence that God's a man, right? Because that's just so inconvenient. But babies do tend to cluster feed around that time. So between midnight and 6 a.m., your baby might eat, and then 15 minutes later, they'll be awake, looking around, and that's a sign that they need to eat again. The first sign that your baby is hungry is that their eyes are open. So once their eyes are open, looking around, put them on your breast to get them to start eating. If your baby starts sucking on their hand, that's a later sign that they're hungry. And then the very latest sign is that they're crying. And typically, if you wait until they're crying to start feeding them, they get really frustrated and angry, and it's harder to get them to latch on. So try to do that earlier rather than later. The best piece of advice that I got when I was first breastfeeding was actually from the pediatrician, and she said, aggressively hydrate those nipples. So what she meant by that was every time baby pops off the breast, you put on some nipple cream. And nipple cream is kind of like chapstick for your nipples. Your nipple skin's a lot like your lips. And if you've ever had chapped lips, you know that when you lick it, it feels better for a second, but then it starts to sting and then it gets worse again. Now, your breasts are not used to being sucked on 15 times a day. So they're going to get pretty dried out and it can really start to burn within even the first day of breastfeeding. So if you just really aggressively hydrate those nipples, put on lots of nipple cream after baby's done each time, that will help you the most. And you don't have to wipe nipple creams off. It's safe for babies to consume that if they pop on again. So you don't need to worry about cleaning your breasts in between feedings. Now, the baby's going to be watched for jaundice, and that's a yellow color of the skin and the eyes. All babies are born with extra red blood cells, and as these red blood cells break down, they release hemoglobin, which turns into bilirubin in their body. And bilirubin is a yellow colored substance that causes the jaundice. Now, we screen the babies visually by looking at them, and sometimes we'll do a blood test, and sometimes we'll do a light test where we put a bright light on their forehead and check the level that way. If the jaundice level gets too high, we do something called phototherapy. And phototherapy is with bright blue lights. We'll put the baby under these bright lights, and that helps break down the bilirubin into a form that they can pee it out. Otherwise, bilirubin just leaves the body in their poop. So the more the baby eats, the more they're going to poop, and the faster their jaundice level will go down. But if it's not going down quick enough, we can add on that phototherapy. If you want to help prevent jaundice in your baby, keep the blinds open as much as possible and try to get a little bit of passive sunlight onto your baby, because that can also help to break down that bilirubin into a form that they can pee it out. Babies that are too big or too small, which is called large for gestational age or LGA, or small for gestational age or SGA, will have their blood sugar tested. And also babies whose moms had gestational diabetes will have their blood sugar tested when they're first born. And that's just because those babies are all at higher risk for low blood sugars. If your baby does have low blood sugar, we'll just feed them a little bit of extra. We can give them either some sugar water or some formula in the hospital. And that typically goes away within the first 24 hours of life, and then they should be fine, just breastfeeding normally. Now, keep in mind, while you're in the hospital, you have a whole support staff there. This is a great time for you to try to catch up on your sleep because you're not going to be able to do that at home. Ask all of the staff for as much help as you need. Any questions you may have, we are all here to help you. And I do recommend having a copy of my book, The Baby Manual. It has all of this information in it, and you can bring it to the hospital with you. There's a chart to keep track of your baby's eating and peeing and pooping at the back. And a lot of the common questions that parents have in the first couple of days of life are in that book. Now, before we send you home, we're going to tell you a couple of things. First, we'll tell you how to keep an eye out for jaundice, what it looks like, and when to get worried about it. So if your baby's eyes are turning yellow, that's usually a later sign of jaundice. And if they're too sleepy to eat, if they're not eating at least once every 4 hours, or if you go to wake them up at 4 hours and they're still kind of sleepy and not wanting to eat, that's usually a sign that their jaundice level is too high. If it gets really high, like over 25, it can cause brain damage. But I find babies start getting sleepy around the 15 to 20 range, and you can see it around the range of 10 to 15. So we always try to catch it early, treat it early so that they don't have any long-term effects from it. But keep an eye out for jaundice at home. The next thing is fever. Anything over 100.4 degrees is considered a fever. And fever is a big deal in newborns. Newborn babies don't have a fully developed immune system. So if they spike a fever, that usually means that they're pretty sick. So if they get a fever, you need to call your doctor right away, and they're probably going to tell you to come into the emergency room to have them checked out. You should have a car seat. You won't be able to leave the hospital without a car seat. And the staff can all help you learn how to install the car seat and how to make sure baby's strapped in tight enough. But you should not be able to pinch the straps together under your fingers. If you can, it's too loose. Really, you want that strap to be tight enough that if you got in an accident and the car seat was ejected out of the car and rolled on the ground, the baby would be totally fine. I did my residency in a big trauma hospital, and we saw a lot of accidents where that actually did happen, and the babies didn't even have a scratch on them. So it needs to be tight enough that if you took that car seat and turned it upside down, they would not fall out, but you don't need to practice. All right. Your follow-up appointment will be set before you leave the hospital. It's typically 2 to 3 days after leaving the hospital. And what you should expect before that next appointment is that the baby's going to lose a little bit of weight. So when babies are first born, they have a little bit of water weight on them because they've been soaking in a bath for 9 months. And also because that colostrum is so concentrated at the beginning, and because for the first time ever, they're having to work to eat. Because, when they're on the inside, all their nutrients come right through their belly button, through the umbilical cord. Those are all reasons that they burn extra calories and that they tend to lose weight. And then because of the low volume of colostrum, they lose a little bit of water weight. So it's normal that your baby will weigh a little bit less when you get to your first visit. The other funny thing that happens is a lot of times they end up a little bit shorter. Now, your baby's not actually shrinking. It's just that when they're first born, their muscles are completely weak and loose, and we can stretch them all the way out to their full length to measure their length. After a couple of days, they start to get more muscle tone. So when they come into the office for that first checkup, their muscles are a little bit tighter, their legs are up just a little bit more, and a lot of them will lose a little bit of height that way. But they didn't actually get shorter, so don't worry about that. That's normal. It's also normal to feel totally overwhelmed, exhausted, and a little freaked out at the beginning. And you're going to be sleep deprived because baby has to eat at least once every 4 hours, typically every 2 to 3, and then sometimes they cluster feed in those wee morning hours. So write down any questions you might have, any concerns you might have, and bring those into the doctor's office with you because you will probably forget what you needed to ask. And also, again, I recommend having a copy of the baby manual because that's going to have all the advice in there that the doctor is going to give you. And they're going to give you a lot, and it can really feel like you're drinking from a fire hose when you go in there. So have this copy of the book with you, and you'll be able to see all of the common questions that parents will have and all the common things that come up. When the belly button falls off or the umbilical stump falls off, sometimes there's a little bit of blood there and a little bit of goo behind it, and that's totally normal. So just wipe it with a clean washcloth when that falls off and make sure it's not actively bleeding. If there is blood dripping down your baby's side, then just take a cotton ball, hold pressure on it for about 5 minutes, take it off again, and it should have stopped. If it still hasn't stopped bleeding, you can call your doctor at that point. And in terms of taking care of the umbilical cord until it falls off, well, you don't really have to do anything but keep it dry because it'll dry up and shrivel up and then fall off on its own. There aren't any nerves behind it, so it won't hurt your baby if you bump the umbilical stump, it's fine. But you want to keep it out of the diaper because if they pee and that pee gets on the umbilical cord, it's going to soak right in. And if you put them in a bath, the water will soak right in. And it's kind of like a dried sponge where it gets just really gross. It can grow bacteria and it can get infected. So keep it dry and clean and out of the diaper until it falls off. And it should fall off within the first 2 weeks of life. Now, one thing to know with baby girls is that they sometimes get a small period around day 3 to 5 of life. And that can be kind of scary to see, but it's totally normal. It doesn't hurt them, and it usually goes away within a day. With baby boys, you should ask your doctor about how to care for their penis, whether it is circumcised or not circumcised. It's slightly different, so talk to the doctor about that before you leave the hospital. And with baby girls, it's normal to have clear or white vaginal discharge. You don't need to scrape it off or really clean it that well. It's kind of like a self-cleaning oven. It just produces that white mucousy stuff and it cleans itself out in the first several days of life. So just wipe it gently with a wipe if you're worried about it. And really, you only need wipes after they've pooped to wipe the poop off of there. If they just have pee and vaginal discharge, that's totally fine. And with baby boys, you only need wipes when they've pooped. Also, just keep in mind who you need to call when you have questions about your baby. So a lot of hospitals, you can call the OBGYN floor, or the delivery unit, and they should be able to help you if you have any questions. And a lot of hospitals will have a pediatrician on call or a pediatrician nurse's line that you can call if you have questions in the middle of the night. All right, I hope this all helps. This is everything you need to know before your baby is born. You can grab a copy of the baby manual on Amazon. It's also on Kindle. And good luck with your new baby. You're going to do awesome. Thank you for listening to the Baby Manual podcast. Please hit that subscribe button below so you don't miss the new episodes when they come out. I would also love it if you could leave me a review. If you'd like to buy a copy of the Baby Manual, it's on Amazon and Kindle. I'm the author, Dr. Carole Keim, and that's spelled Keim. You can also follow me on YouTube, TikTok, Instagram, or Facebook to get some quick baby tips that will make you feel like an expert. Thanks for listening.